My name is Kelly O'Connor, student nurse at NTC, and today I'm going to be administering a blood product through an IV. So I've checked my orders here and I've checked the chart to make sure that this patient is indicated for receiving blood products and the physician has ordered those things. I've also gathered my supplies here, as you can see. One of the first things I have is a signed consent form, which is necessary to be able to give the blood product. I also have the paperwork for the blood that she'll be receiving, my blood tubing. I have normal saline here, which is clear and clarity, and it is sterile and not opened, and there's no expiration. It is not expired. This is the only thing that's compatible with the blood product is normal saline. I have some items here for getting vital signs, alcohol preps, tape, saline flush, and then depending on agency policies, I would also do an additional blood filter or a warmer as needed. And then I also have a pair of gloves. So I'm gonna walk into the room and wash my hands. Provide for privacy. Introduce myself. Hello, my name is Kelly O'Connor. I'm a student nurse with NTC. I'm going to be administering some packed red blood cells for you today. I just need to confirm your name and date of birth according to your medical records here. If you could just tell me your name and date of birth, that'd be great.
Betty Jones, date of birth 11/21/2022.
Perfect. Betty, that matches my chart and it also matches her name band. So like I said, I'm going to be giving you some packed red blood cells through your IV that we've already established here. You had a GI bleed and your hemoglobin is low, so that will help with that. If you have any questions during this, please let me know. So some of the things we want to monitor for is sometimes patients can have an adverse reaction or a reaction where they are allergic to the blood that they're given. And so you please let us know right away if you have shortness of breath, chest pain, back pain, itching, nausea, chills, fever, headache. Let us know if there's anything of that going on, okay? Awesome. Okay, and then what I'm going to have you do is I'm just going to have you scooch over a little bit towards me. Perfect. And by that, I am verbalizing that I understand that she can follow my commands and also understands what we're doing here today. So I'm just going to check your IV, okay? I'm looking to make sure that there's no infiltration, no swelling, edema, redness around the area and the site. Make sure that it's a fresh one. I see that it is a 20 gauge. We can use anywhere from 18 to 22. The bigger the better, but this 20 gauge will work for us. No other medications have gone through it. We can also do a saline flush through here if we need to make sure that the line is patent as well. And then the second thing, Betty, that I'm going to do, I'm going to just raise you up a little bit and I'm going to do a full assessment of your lungs, and then I'm going to take some vital signs. So I would assess her lungs fully, and then I would also check heart rate, blood pressure, pulse, SpO2, and temperature for sure. Make sure we have our baseline set of vitals just in case you have an adverse reaction, okay? Do you understand?
Yep.
Awesome. Any questions with that?
No.
Perfect. Okay, so the next thing I'm going to do, I've washed my hands now just because I touched my patient here, is I'm going to verify the blood products with the physician order too. I'll double check to make sure that this is what the head physician has ordered. And then I'm going to bring in a nurse to help verify the blood numbers with me to make sure we're giving the right patient the correct blood. So I'm also going to just kind of look here and make sure clarity is okay. There's no clots in there. There's nothing floaties or air pockets or anything like that in that blood. So what we're going to do is we're going to go over the numbers. So I have medical record number 224466.
Medical record number 224466.
Location HLRL.
Location HLRL.
Account number 123456.
Account number 123456.
I have Betty Jones, date of birth 11/21/2022.
Betty Jones, date of birth 11/21/2022.
Red armband number 456654.
Red armband number 456654.
Patient blood type B positive.
Patient blood type B positive.
Donor pool number 7890.
Donor pool number 7890.
Units in pool 4.
Units in pool 4.
Volume 250 mLs.
Volume 250 mLs.
Blood component PRBC.
Blood component PRBC.
Expiration date and time 12/17/2023 at 1500.
Expiration date and time 12/17/2023 at 1500.
Donor blood type O positive.
Donor blood type O positive.
Compatibility test completed.
Compatibility test completed.
Date 12/17/2023.
Date 12/17/2023.
Perfect. And we are confirming that she is B positive and the donor blood type is O positive. So those are compatible. And we've also ensured that this is not left out more than 30 minutes from when we got it from the lab. So now I'm going to be starting to prepare my IV line. I've washed my hands. I'm going to put on my gloves. As I've said before, normal saline is the only thing that's compatible with blood. I have my tubing here. Apologize, that keeps coming off, but we would make sure that it's sterile. So I'm going to grab my tubing out and make sure that everything is clamped prior to spiking any bags here. And then I'm going to maintain sterility. Put this here and take that off. Spike my normal saline first. Hang that up. And then what we're going to do is we're going to flush through the line here. Make sure we get all the air bubbles out. Perfect. So we've secured that, close that clamp. And what we're going to do is we're going to close our normal saline clamp here. We're going to get our blood product. Checking again, making sure there's no blood clots, air bubbles, or that it's discolored. And then we're just going to kind of push back and forth to make sure that all the blood components are equally mixed in there. We are going to grab the other port here and spike our bag. Hang this as well. Like I've said before, our normal saline is shut off here. So we're going to open up the blood side. We're going to get it into the filter here first before we open it up. We want it to completely cover the filter so that the blood does not lyse. So that's mixing with the normal saline there. Filter's completely covered, and then we are going to let it completely come through until it comes to the end here, so that when we check for reactions, it's already at the patient side. And then we've also made sure that we are not wasting any, so it's just come to the tip of the port there. Roller clamped that, double check to make sure my normal saline is off. Going to be putting this into the pump here first. And then I'm going to clean my port. 15 to 30 seconds. I would throw that away. I'm going to attach my blood here. And then I could also tape that up on the patient's arm so that it's not hanging down on the ground. Before we turn our pump on, actually, just to maintain cleanliness, we are going to take my gloves off, wash my hands. I'm going to get my blood product set up here. We are going to start our blood, our PRBCs, at a rate of 50 mLs an hour for the first 15 minutes to ensure that we're monitoring in case there is a reaction. So we're going to start. So we're allowing that to go for the first 15 minutes. We're going to be monitoring our patient the entire 15 minutes in here. We're going to assess our vitals every 15 to 30 minutes as well. After those first 15 minutes are up, we can look at our order and increase the mLs that are needed for the patient, monitoring for reactions such as dyspnea, chest pain, back pain, itching, fever, chills, anything like that the entire time we're in here. When the blood product is finished, what we're going to do is we're going to clamp off where the blood was coming out and open up and flush with the normal saline until all the blood is out of the tubing. If there were to be some type of transfusion reaction, we would ensure to stop the blood immediately, send the tubing and the blood product to lab with a note letting them know that there was a reaction. We'd call the physician, give any medications that would pertain to an allergic reaction, depending on how bad it is. And then we would hang a new bag of saline and with new tubing to flush the IV and flush the blood out of the system. I would make sure that my patient's in a comfortable position. The bed would go back down, they'd get their call light, the rails would come up on the bed. Some lifespan considerations that we could consider would be a smaller patient may only be getting a certain amount of the red blood cells that are in this bag, so to ensure that we're dosing that patient correctly. They may have a smaller IV, so they may have to get their fluids going in slower than an adult patient. Patients who have bleeding issues, we'd want to monitor them. And maybe immunocompromised patients may be more at risk for developing allergic reactions as well to that. So I've provided for safety and comfort for my patient. They've gone down. I'm gonna wash my hands, tell them if they need anything, let me know. Walk out of the room. I've cleaned up my supplies already. And I would also go and document date and time, the start and stop time, the type of blood, donor blood versus patient blood type, armband number, the type of blood it is, expiration date, any adverse reactions, and the site and the size of the needle that is going through. With that, I'm done.